young Boda Boda cyclists. So we are going to begin shortly. We are simply waiting for few more colleagues to join, and we start the process. So I thank you very much for the members who have joined. Here is the program for the workshop. We shall have e-registration. All the members who have logged in, kindly register in the chat.
Examination. Agenda.
Our agenda is, I've shared the agenda on screen. We have all members are required to register their participation. Opening prayer, opening remarks from the head of department, and then remarks from RIF, introduction, research, objectives and methodology, and then final research, and we shall have Q&A sessions. It's okay. Okay, you get the. Do you need a microphone? Yes, the principal is in. Yes. You're welcome, Mr. Principal. Yeah. I think we are set to start our meeting. I would like to invite, we are beginning with opening prayers. We invite Dr. Nance Buga to give us the opening prayers.
Let's humble ourselves for prayer. Lord, we thank you for today. We thank you for the good health of all the persons present for this meeting. We pray for fruitful deliberations aimed at improving road safety and reducing illicit drug use. Amen.
Thank you very much, Elizabeth, for the prayers. And next, I would like to invite the head of department population studies to give opening remark. And after the head of department, he will invite the principal college of the principal college of business and management sciences to also give us a remark. And then we shall continue like that. Thank you very much.
Thank you very much, MC, Dr. Misindi. The Principal College of Business and Management Sciences, all the participants from the Ministry of Works and Transport, Uganda Police Force, especially the Anti-Narcotics Department, Uganda Harm Reduction Network, which is an NGO that collaborated on this project. I also want to acknowledge the Reef Secretariat and the government of the Republic of Uganda. Good morning, ladies and gentlemen. I have a few remarks to make before I invite the principal of the College of Business and Management Sciences. First of all, I need to say congratulations to the research team. That was a collaboration between the different ministries of government, the Ministry of Works and Transport, Uganda Police Force, and Uganda Harm Reduction Network, and the Department of Population Studies. My name is Stephen Wandera. I am the acting head for the Department of Population Studies, School of Statistics and Planning, College of Business and Management Sciences at Makerere University. I want to say congratulations to the team for pulling the project, for implementing it to this far. And secondly, I really want to thank you for the teamwork that you have exhibited in being able to pull this project together. You have implemented this research in a very difficult time, and you've addressed a very critical component of research. It's a very timely research theme, the focus on drug use and and road accidents in particular is very critical. I want to just say that the journey is not really coming to the end. It's just the beginning of a very long journey, which is publications. I'm very happy that you have a policy brief, which you try to work on. I would say that this policy brief should be published and be accessible to all the different government agencies, ministries, departments, and agencies, and then also ensure that you have some publications that can be resulting from different journals and so on. I don't want to say a lot, but I just want to encourage the team that make sure you push it through to the level of having the policy brief published by some other publishers and have it shared with the different line ministries. I want to express my thanks to the government of the Republic of Uganda for supporting your project, which is part of the Mark Reef Research and Innovations Fund. And I want to appreciate the Reef Secretariat for being able to support you to this very end. And we are very glad that we had collaborators that you worked with from the side of the government and from NGOs sector. I also want to say finally that the Department of Population Studies is proud of all of you as a team, especially Professor Betty Kwagala and your team, who have worked tirelessly on implementing this project. At the department, we are very proud of you and we are looking forward to supporting you in every way possible so that this fine product can be attained. And the other thing I needed to say in closing is that as a Department of Population Studies, we are very keen on research themes that influence the health and the behavior of humans and the entire population. And to do that, we have teaching programs. For instance, we have a Master of Science in Population and Reproductive Health and a postgraduate diploma in demography. And some of these issues are very key in our teaching and curricula. So I would want to end here and just wish you a very fruitful discussion of the results. And therefore, let me take this opportunity to invite the principal of the College of Business and Management Sciences, Professor Hisali. You're welcome and have a very nice day and very fruitful deliberations. Over to you, Professor Hisali. Thank you.
Okay, good morning to you all. And thank you, Dr. Wandera. Thank you, Dr. Misindie. And thank you, the research team, for inviting me to make the opening remarks. The head Department of Population Studies, our colleagues from the Reef Secretariat, the research team, our partners from Ministry of Works and Transport, the Uganda Police Force, our friends from the media. Good morning to all of you once again. I apologize for the delayed start. We lost some time at the beginning, but allow me say just a few things. Number one is to reiterate what Dr. Wandera has already said, which is to congratulate the research team. Congratulations and thank you for making us proud. Number two is to most sincerely appreciate the Reef Secretariat for the support that they continue to give us. We do not take this for granted and want to say thank you. To our collaborators, Ministry of Works, Uganda Police Force, and all the other collaborators, we appreciate these engagements and we want to think that these collaborations will not be looked at as a one-off, but rather as a starting point for even stronger collaborations through which we work on a number of very important topics that influence the policy direction of this country. So we really appreciate you. Now, this morning, we are doing a dissemination. Now, for me, a dissemination is going to be just a starting point in a very long journey of activities. There are a number of things that we should be now building on. The first challenge I want to leave with you colleagues is to pick some of the interesting results from these studies and integrate them into what we teach. We make reference to literature from many different parts of the world. But we have now matured. We have quite a number of studies and research findings which can immediately be useful in terms of strengthening our curriculum with real life examples from within our environment. We'll be extremely happy to look at a course outline with references made about this study. So that is one area that we need to look at as we take this forward. The second one is what Dr. Wandera already alluded to, the issue of publications. Publications will help us reach a wider audience with these findings. Today, I can see here online, we have about 21 participants, and then plus the team that we have here. But once we take this into a very good outlet, then we reach a wider audience. Fortunately, at the college, starting this financial year, we are introducing a new modality of support to encourage publications. You'll recall, colleagues, that for the last 5 years or so, we've been giving what we've been calling the small research grants and publication support. We've been having conversations over the last year, and we have now agreed to change that support, actually to terminate it for now, and instead use the same resources to support publications in accredited outlets. So we look forward to this one being among the first. And once you come with a publication from an accredited outlet, you will be given a small monetary reward of appreciation. We want to encourage these ones to get out there. Number 3 is the issue of policy engagements. The dissemination today, the policy brief that you have come out with, in my view, is not sufficient for policy engagements. We will require additional follow-up actions to mainstream our findings into policy. Already, you have done the first bit by getting colleagues from Ministry of Works, from the Uganda Police Force and other agencies on the teams. That one is quite important in the acceptability of the results. But we need to do a lot more beyond the dissemination and beyond the collaboration that we have done. The challenge I want to leave in this regard is that we should consider strengthening what we might call the policy labs. Now, the idea here would be that using this network that we have already started off with, we can agree to have meetings, possibly once in a quarter or twice in a year, take off half a day or a day, and come together as a team, Ministry of Works, in this case, Uganda Police Force and ourselves here, and follow up on certain topical issues that might require guidance and shaping of policy. And either we will be using the findings that we already have, but in situations where the findings are insufficient, these policy labs can be a fora for coming up with relevant research topics. So this is yet another area that I think we need to be taking up as we take this activity forward. So ladies and gentlemen, I think I will leave it at this. Once again, I want to thank you. I want to congratulate you. And I wish you the very best of luck on this journey forward. Thank you so much. And I think with that, I declare this workshop open, this dissemination. Thank you.
Thank you very much, Professor Isali, the principal of College of Business and Management Sciences, for the knowledge you have given us. I would like us to continue with our program. And at this moment, I would like to invite the PI for this project, Dr. Kwagala, to give us an overview of this project. You're welcome, Dr. Kwagala. You're making presentation?
No, not really. Good morning, everybody. Sorry, let me remove the mask. I just want to introduce the project and maybe to introduce the team to you. This project, you could have seen the title, is called Improving Road Safety in Uganda, on-spot testing for illicit drug use among Boda Boda motorcyclists, or the ones that we normally call Boda Bodas. So the team that conducted this study is a versatile one. You may have heard some hints about it, but we were 4 entities or stakeholders that are interested in road safety and the well-being of people that use the roads. So we had the Uganda Police Force represented by Mr. Tinker. That is the Department of Narcotics, is it? Yes, the Department of Narcotics. And then we had the Ministry of Works and Transport. We had Dr. Richard Sendi. We had Uganda Harm Reduction Network, represented by Mr. Wamala Twaib and Mr. Dan Katende. And then we have the Department of Population Studies, Makerere University, that is represented by Betty Kwagala, Dr. Patricia Nduga, the soon-to-be Dr. Olivia Nanchinga, Dr. Ambonye, Dr. Elizabeth Nansubuga, and Dr. Cyprian Misinde. So this team worked together to come up with these findings. I'm sure you hear a lot about their experiences in the field and findings. the major, one of the major issues that we addressed when we were addressing drug use among cyclists was to pilot the on-spot test kit that can be used on the road to get results in a short time. You hear more about that and you see how it looks. And we'll hear more about its feasibility and its use in Uganda. That's all I have to say now. You're welcome to participate in this workshop. Thank you.
Thank you very much, Dr. Kwagala, Professor Kwagala, who is the principal investigator for this project. Next, I would like to invite Dr. Patricia and Ms. Olivia Nanchinga to make a presentation about the findings of the project.
Okay. Good morning, ladies and gentlemen, and colleagues online. I would like to take this opportunity to welcome you to this webinar where we are sharing our study findings. As already indicated by the MC for this day, I am Dr. Patricia Nduga from the Department of Population Studies. I teach and conduct research in that department, and I am honored to be part of this great team, a team from Ministry of Works, from Uganda Harm Reduction Network, Uganda Police Force, and my colleagues from the Department of Population Studies. My task here is to take you through our presentation on the research findings from this study. The presentation is structured. I will take you through, I'll take you through the first part that has the introduction. It has the study objectives and it has the methods, whereas my colleague and teammate, Olivia Nanchinga, will take you through the findings, the conclusions, and the recommendations. According to the Uganda Bureau of Statistics, more than 2/3 of road traffic accidents are attributed to motorcyclists. Studies have also shown that riding under the influence of drugs increases the risk of road traffic accidents. And I believe many of you are familiar with this in Uganda. While we know that the Uganda Police Force has been actively arresting motorists who are driving under the influence of alcohol using a breathalyzer, or kawunyemu as we call it, we have no evidence to, we lack scientific evidence on the magnitude and implications of illicit drug use among motorcyclists, and yet this is a key population that needs to be targeted. So what did this team set out to do? We assessed the feasibility of on-spot testing of illicit drugs. By illicit drugs, we are talking about the very harmful drugs on the market that affect cognitive abilities of the riders. We believe their judgments are affected once they are on the road and they will not, say, observe traffic regulations.
So we wanted to assess if we came up with a drug testing kit, would this be acceptable to the cyclists? We also needed to estimate the prevalence of drug use among Boda Boda cyclists. This is something that was new. We don't have a record of the prevalence of drug use among the cyclists. And then thirdly, we looked at the determinants. What really pushes these men into using drugs and riding under the influence of illicit drugs? Illicit drugs examples include drugs, say, like marijuana, it could be cocaine, it could be shisha, a whole range of them in the market. And lastly, we also examined whether there is an association between drug use and the risk of road traffic accidents. So how was this done? We used a mixed method research design. That is, we combined quantitative, we had a survey, but we also had qualitative methods. This study was conducted in Kampala district, in specifically 4 divisions out of the 5. We targeted Nakawa, we had Rubaga, we had Makindye, and Kawempe. The study population, just like in the title, this study was about Boda Boda cyclists. So our primary target population was the cyclists operating within Kampala, given that this study was in Kampala district, and those aged 18 and above. So we also targeted commercial motorcyclists, whether you belong to a company, say like Safe Boda, Uber, but also whether you are a freelance rider, you own a Boda Boda, you don't belong to any company. Sorry, whether you don't belong to any company, you are also eligible for interview. During this study, we also had a team of research assistants. I know some of them are online right now listening in, about 15 of them who worked tirelessly. Sorry, we are trying to ensure that the presentation is projected. I didn't know it wasn't being projected for you. Just a moment. David, just a moment as we sort this out.
Maybe we stop first and then share.
So we want to share as.
It's now okay.
Is it? It is, eh? Okay. Let's see. Technical glitch we are trying to sort.
Okay, let's close some of the room.
I think in the full screen. So it can move.
Yes. We can move. Then we need to remove this. Are they seeing another full screen? Yes.
Sorry about that. Okay. So earlier on, I mentioned that our study population were commercial motorcyclists operating within Kampala district. And we had a team of 15 research assistants who supported us in collecting the data. In terms of the survey, we had, the team developed a questionnaire that was translated to Luganda, which is the language that is predominantly spoken by most people in Kampala, including the cyclists. But we had an option for English to cater for those who might have challenges with speaking maybe Luganda. The questionnaire was loaded onto a tablet, which had ODK software. And prior to the actual data collection, we had to pretest the instrument. And this was done in our neighboring, in Wakiso district in Gayaza, where we reviewed the questions and checked for any other corrections that needed to be made before the actual data collection. In terms of the sample size, we had 785 cyclists for the survey. And of these, we managed to use our saliva test kit, which we are also calling the oral test kit. We tested 450 of them for whether they were positive or not for drugs. So that's a picture showing the kind of kit we used. This was a kit that was imported from, this was an imported kit. And on your right, you can see one of our team members supporting the collection of the saliva as the testing was taking place. Those are some of our participants. And yeah, this study was also conducted during the COVID-19 pandemic. So SOPs were being observed. The team had to wear masks. So that was the survey, but when it came to the qualitative methods, we had two key methods. We had the key informant interviews conducted with key people in Kampala who were directly involved with the cyclists and who also handled treatment and prevention of drug use. So some of our key informants were from NGOs such as UIDEL. We had traffic police, Kampala Metropolitan Police officers. We had Butabika National Referral Hospital, because we know drug use affects cognition, and we know that mental issues are likely to arise or arise out of that. And we also had Ministry of Health on board. We worked closely with staff from Ministry of Health, School of Public Health, and then the Boda Boda leaders also supported this study a great deal. For the focus group discussions, these were discussions with small groups of people of about 6, 7. We were observing SOPs. We had discussions with Boda Boda cyclists, getting a general picture of why are they using the drugs. And then we also managed to have an interview, a focus group discussion with a team of traffic police officers. Maybe before I talk about other project activities that were conducted, this study received ethical approval from, we used the TASO Institutional Review Board to approve this study. but also got final approval from the Uganda National Council for Science and Technology. And Ministry of Health also provided guidance along the way. So other project activities besides the survey and the qualitative interviews that were conducted, we've had a series of stakeholder engagements. These included the Boda Boda leaders. We had some with the Boda Boda cyclists, talking to some of the officials who are directly involved on this project. We also had produced IEC materials. I'll be showing you samples of the materials that were received, were made or designed and distributed. We had reflector jackets, we had posters, and we had stickers that the cyclists were meant to stick on their motorcycles. All these messages rotated around enhancing health and safety. We also had some sensitizations of Boda Boda cyclists. And during these sensitizations, we distributed IEC materials, which they distributed in the different stages where they work, but also gave fellow Boda Boda cyclists. We conducted some media campaigns on radio and television, and the choice of radio and television was guided by the leaders. They knew which stations are listened to by the cyclists, and we are happy to note that we got a very good audience, active audience during these campaigns. And right now we are conducting a dissemination workshop for the findings. So those are on your left, that's a picture showing the one of the sensitization meetings we conducted with the cyclists, and within that meeting, we were able to distribute some of our material, the IEC's information, education, and communication material that we designed and that we developed for this population. So in the middle, we have those reflector jackets. They had messages in both Luganda and English. As you can see, the first one has Ndiwa Boda Boda, Siko Zisabira Galalagala. So, and also had others in English, your safety is my priority. And all these were emphasizing health and safety. On the extreme corner, on your right, we have a sample of a poster that was designed. It was also in Uganda and clearly saying that Ndiwa Boda Boda Siko Zisabira Galalagala. So it kind of built some level of confidence. We believe it would build confidence in a passenger. If I see such a message, I believe I'm safe. And that picture in the corner at the bottom right, that's one of the cyclists donned in our reflector jackets that were designed. I want to thank you so much for listening to me. And as I invite my colleague, Miss Olivia Nanchinga, to take us through what we found in this study. Thank you very much.
Morning, ladies and gentlemen, and everyone online who is joining us for this dissemination. My name is Olivia, and I'm going to continue at the spot where my colleague stopped, and that is to present these findings of the study. And before I go to the key findings, I want to present to you some of the characteristics of the respondents that were part of this study. That is the Boda Boda cyclists that we interviewed for this study. One of the characteristics is that most of these were relatively young people, and the mean age was about 32 years. Over half of these did not have formal schooling or had only up to primary education. And the majority were married or were in union at the time of the survey. And then 81% of these were living with their family. And concerning religiosity, about 84 of these reported that they used to go to their place of worship at least once a week, that is before the COVID restrictions. When we come to issues to do with riding, only 3% of the cyclists that were part of this study indicated that they had gone through professional training, that is a driving school to learn motorcycle riding. And that means the rest, the 97% were either trained by friends or family or learned on their own. So that has implications to road safety. And then of these, only 11% reported that they had a valid driving permit. And with this, we went further to ask them to show us the driving permit. So it is people, the 11% are Boda Boda cyclists that had the permit and showed it to us as researchers. And then about 68% of these cyclists reported that they've ever been involved in a road traffic accident. When we go to use of substances, about 1 in every 4, that is 25%, reported that they've ever used anything to work for long hours. And of course, this also has implications. So one of the participants in the focus group discussion actually stated that the cost of acquiring a permit, that is Class A, which is about over 300,000, is really high for a Boda Boda rider, and therefore explained that this could be one of the reasons as to why some of them did not have a valid driving driving permit. And then another was asking us to tell him whether there is any school that we knew of that trains cyclists. Of course, this also has an issue to do with why some of them do not have a valid driving permit. Going forward, we looked at the use of illicit substances, and like earlier explained, we are looking at everything that is used but is again prohibited by law. We had self-reported cases, and then there are cases, the 450 cases that my colleague earlier talked about were the tested cases. So from self-reports, about 12%, that is for the first graph that we have, about 12% of the Boda Boda cyclists that were part of this study reported that they've ever taken something illicit. And from our test results, about 10%, that is 1 in every 10 Boda Boda cyclists tested positive for illicit drugs. Of course, this has implications on the health and mental state of the cyclists. And that is why we went ahead also to establish, to find out which common drugs they take. And from our results, the most common drug taken by the cyclists was methamphetamine, which was taken by 24 of the cyclists. And then we had the second group taking cannabis, which is commonly referred to as ice or crystal. And then we had about 7 of the cyclists reporting that they take cocaine, which is locally referred to as cavalli, stone, or rock. So those were the most common types of drugs taken by the cyclists. We went further to establish the reasons for taking drugs, and results showed that the most common reason as to why Boda Boda cyclists took drugs was to enhance performance. That is to get energy and strength. And this was reported by over half, which is 58% of the cyclists. And then we had others stating that the reason as to why they take drugs is to forget their problems or physical pain, which was mentioned by about 41% of the cyclists. And again, one of our respondents in the survey told us that about 80% of Boda Boda cyclists accumulate loans to be able to meet the requirements of the owners and as well to take care of their families. So they have to work for longer hours and end up using illicit substances to stay awake on the road. One of the objectives of this study, as mentioned earlier, was to find out the feasibility of on-spot testing, and results showed that 90% of the cyclists consented to taking the tests. Remember, this is an oral test, but we had just a few refusing to take part in the testing, and results from these tests can be read from between 5 and 10 minutes. You're able to get the results. And this shows that this tool is an on-spot tool, and therefore you can be able to stop the cyclists, take the test, and be able to read the results and know exactly the status of the cyclists. And then we had a question on whether these cyclists thought mandatory oral testing by traffic police is useful and should be done. And about 91%, 9 in 10, reported that it is useful and should be done. And that is the graph that I have presented before you. Though there are so many advantages about the tool, we also have noted some limitations about this oral test. And one of the limitations is that the kit does not test some of the locally used substances. And some of these substances include shisha and mairungi or cat. So the test was unable, the kit was unable to test these results, these drugs. In addition to this, it is a requirement that the person testing, knows the active compounds within these locally consumed substances so that they are able to know what they are testing. Additionally, the unit cost of the kit was about 60,000, and that is an equivalent of $17 US. And to us, this is a bit on a higher side. And therefore, if this is to be done, there is a lot of funding that may be needed in order to have the cyclists tested on spot. We went further to to establish the determinants of self-reported drug use. And with self-reported drug use, we looked at use of illicit drugs within the 3 months preceding the date of the survey. And we found out that age of the cyclist, religiosity, owning a house, and ever having been involved in accidents were associated with self-reported drug use. So we had, but we went ahead to adjust for other factors that included division of operation, education, internet use, and living with a family. So these results showed that the older the cyclists, then the lower the chances of using illicit drugs. And concerning religiosity, cyclists who reported that they frequently go to their places of worship had lower chances of using drugs. And then also coming to ownership of a house, those that reported having a house had lower chances of using illicit drugs. But those that had ever been involved in an accident reported higher chances of using illicit drugs. Now, from these results, looking at age, we know that the chances are that these older cyclists have family and maybe have more responsibility and probably have more targets in life. And this could partly explain why they are less likely to use drugs. But also one of the issues that we found out is that some of these cyclists do not own the Boda Bodas. So the older the cyclists, we think the age of the cyclist could also be a determinant of ownership of a motorcycle. And for those that own motorcycles, of course, we don't expect them to work longer hours than the cyclists that may not own the motorcycles. And then coming to religiosity, we know that mainstream religions have teachings about against intoxication. And therefore we think that if the cyclist goes to their places of worship more often, then they are less likely to use drugs as a result of the teachings that they receive in this place of worship. And then coming to ownership of the house, we think ownership of a house may be associated with maturity, responsibility, and this could also be an explanation for the low use of drugs among such cyclists. And then, of course, the key issue about accidents comes up even here, where those that reported to have been involved in accidents have higher chances of use of illicit drugs. So we think that use of illicit drugs has an effect on stability on the road and other issues to do with road safety. The other objective of this research was also to find out the determinants of use of illicit drugs, this time using results of the tests. Remember what I presented before was about self-reported cases. And this time we wanted to find out, do results differ for those that tested positive? Our findings still show, our findings showed that division of operation, religiosity, and living with a family were associated with illicit drug use. And we adjusted for other factors, including age, education, level of the cyclist, internet use, ownership of a house, and having an accident. And from the line that is shown across, all the bars that are below the line shows less chances or likelihood of using drugs. And our results show, as the bars that are shown, that cyclists in Nakawa are more likely to use drugs in comparison to cyclists in Kawempe. And this could be attributed by the fact that Nakawa has lots of hotspots for drug suppliers that may be contributing to access and ease of access to these drugs, and therefore increasing the use of illicit drugs among the Boda Boda cyclists. And in the same way, religiosity showed association. There was an association between religiosity and use of illicit drugs, whereby those that went to their places of worship more often had reduced odds of using illicit drugs. And this also talks to our finding for the self-reported cases, whereby we think the teachings in the places of worship to do with intoxication and preaching against use of drugs could be a factor that leads to lower use of drugs for people that attend their places of worship more regularly. And then talking of the family, we know that family is having a family is associated with more responsibility and accountability. And we think that if a cyclist has someone to report to, whether it's a spouse or a guardian or parent, then the chances of using drugs are likely to reduce. We further went to establish the relationship between drug use and accidents while adjusting for other factors that we talked about: the division of operation, the age of the cyclist, education level, ownership of a house, and living with a family, and found out that cyclists who took drugs or who tested positive for illicit drugs were more likely, and from the graph that I have before you, it showed that they were almost over two times more likely to report involvement in road traffic accidents. And from these results we know that if someone is riding under the influence of drugs, they are likely to have issues with cognition, that is decision making. They remember when you're on the road and you're driving, you have to make decisions to do with braking, hooting, turning. And if someone is under the influence of drugs or intoxicated, chances are that they are going to make the wrong decision, which often leads to road traffic accidents. So from our findings, we have a conclusion to make. One is that the prevalence of illicit drugs from these study findings stands at 10%. That is from the results of the tests. And utilization of the on-spot test kit is acceptable to most of the cyclists, since we saw that over 90% were willing to take part in oral testing and can be used with ease. It doesn't require a lot of medical knowledge. And then further, we found out that cyclists that were young, irreligious, and did not live with families were more likely to use illicit drugs. And lastly, we found out that illicit drugs, that cyclists that used illicit drugs were more likely to report involvement in road traffic accidents. And from these findings, we have a set of recommendations to make. One of the recommendations is that there is need to strengthen the policy on illicit drug use for improved road safety. There is need to identify, counsel, rehabilitate cyclists addicted to drugs, and with emphasis to high risk groups. For example, those in Nakawa and those that are of particular characteristics. And there is need for professional driving to be made available for cyclists, and thereafter issuance of driving permits, because like we presented, most of them did not have driving permits. And there is also need to increase funding for police to be able to procure testing kits. We also recommend that there is the existing drug use and traffic regulations are enforced with integrity, so that we are able to stop the use of illicit drugs by road users. We also recommend punitive measures to discourage riding under the influence of illicit drugs. We recommend that there is need to curtail the supply chain of illicit drugs, since some of these are imported. So if something can be done, I know the supply would be cut. There's need to develop a tailor-made on-spot saliva test kit that isolates locally consumed substances like the cut and shisha that we earlier talked about. Since our kit was unable to test some of those, there is need to register cyclists so that enforcement of regulations on road safety is easier. And then since we found out that there are people and institutions and organizations that are doing a lot of work to do with drug use and rehabilitation and control of illicit drug use, but there is need to have formal partnerships and coordination mechanisms, so that these efforts are done in a way, in a structured way that will enable all these institutions and stakeholders to achieve the target. And then lastly, we recommend that studies on illicit drugs are done. We recommend that studies on illicit drugs are done for all regions in Uganda. And if this is done, we know that we shall be able to contribute to the Sustainable Development Goals on road safety. That is target 11.2 and 3.6 that looks at improving road safety and also reducing global road traffic deaths and injuries by more than half. And also, we believe this will contribute to achievement of the National Development Goals on reducing road fatalities. Thank you so much for listening.
Olivia, for the presentation. And thank you, Pat, too, for the presentation. Now we are going into discussion now, questions and answer session. The finding is clear that when you board or use a Boda Boda, you know that 1 in every 10 is taking a drug. So as we continue to use the Boda Boda, we know that we are exposed to the risk of using a Boda Boda who is under the influence of illicit drug. This is what this study is showing us. And therefore, we need to discuss areas, what should be done. The study has made a recommendation. Now it is open to the public, to the members, to ask questions, to provide, or give comments. You can just raise up. We already have some questions in the chat. There's a comment. We have a comment. Kindly share with us the recordings and the report presentation. After we shall do this, we shall share the report and even the policy brief we have developed for this study. Thanks for the study. It highlights key issues specific to Boda Boda riders regarding drug use. This is a comment from one of the participants. We have another comment. This is a question. What do you think would be the odds if you had an interaction effect between age and religiosity? What do you think would be the odds if you had an interaction effect between age and religiosity? This is a question from Charles. There's a comment, nice presentation from Elisa. Very beautiful findings. Thanks, Olivia. That is from Lokwata, Dr. Lokwata. Then from the Dean, thank you, all presenters. We have comment from Judith Kara. Thank you very much for the interesting findings. Detailed presentation. Thank you, researchers and Olivia, for sharing the presentation. There's a question here. What medical help advice did you extend to those who tested positive for use of illicit drugs? What medical help or advice did you extend to those who tested positive the use of illicit drugs. I think one of our partners from harm reduction will answer this question, because during the survey, we made referrals to harm reduction. There's a hand up from Dr. Wakadala. Dr. Wakadala.
Thank you so much, presenters, and it has been really a very nice presentation. And really, we thank the researchers for coming up with very interesting findings to inform policy, but also to guide us as Boda Boda users. This is really exciting in the sense that we have had really so many accidents on the road. And I think most of us really confess that whenever you board a Boda Boda, we call them the necessary evil. They are necessary, but they are also evil. And you realize that Boda Bodas is the kind of transport really you cannot avoid. But boarding it again, it is as if you are really putting your life on the cross. That's why some of us actually, when we are using Boda Bodas, we actually drive too. You are with a Boda Boda rider, but you are driving with him, checking on the speed, checking on how he's navigating in the jam. You guide him all through until you reach where you arrive. But my question is that I don't know whether the study tried to dive deep in finding out the triggers of drug abuse or taking drugs. Because okay, if you did that, then well and good. But my understanding is that there are really so many other psychosocial and confounding factors that really drive these riders into taking drugs. The very first one, which I actually know of, or I am aware of, is the stress arising from these Boda Boda guys paying back the loans. You realize that actually most of these Boda Bodas, they use loaned motorcycles, and they are always on surveillance 24 hours. And they really try to work so hard to really ensure that they meet the timelines of paying back the loans. And as a result, I think it brings stress on their part, including the security around where they drive these Boda Bodas. So I don't know whether the study also tried to come up with any of such finding, such that in the way it can inform governments on how to support these Boda Bodas, like giving them loans or whatever, something like that. Otherwise, this is a very exciting study, and I think government, security forces really are ready to use these findings to guide their services in the police force and the army. Thank you so much, presenters.
Thank you very much, Dr. Wakadala, who is the Dean School of Statistics. He has raised a very important question. Did the study find out the triggers of drug abuse? And he also added that stress could be one of the serious issues, the psychosocial factors forcing these people to take drugs, which I think it is in agreement with the findings of the study. that quite very many Boda Boda people are actually servicing loan. Though the multivariate analysis did not show a significant result between loan and the drug taking. Olivia will add more response to this. But I think the question is the triggers of drug abuse. From the study, one of the major reasons why these people take drug is to get strength. To get strength, to work long hours, and energy. That's according to them. That's the perceived reason why they are actually taking drugs. But there were so many other reasons. For example, peer pressure also came out as one of the reasons for taking drugs, influence of others, and many. We have Dr. Zabona online. Dr. Zabona.
Hello, could you hear me?
Yes, please.
Okay, thank you, the MC, and thank you, the researchers and all the presenters this morning. This is an exciting study which touches on a very critical issue in this country. I have two issues. One is a question, the other one is an observation. The question is on the test kit, a very simple question really. This test kit, does it have, for example, like some nomenclature, a name, so that people can cite it if they want to do a similar study somewhere else? Beyond it being referred to as oral test kit, is there some name that one can refer to? The other one is an observation, as I said, and basically that is my main point here, to commend the team for such a great piece of work. I am particularly interested in the results where 3% are trained by professionals and only 11% have permits. These are very worrying conditions, and therefore this means that when we have accidents, it should not surprise anybody, because the situation on the ground is not good, and this should really indeed feed into policy, because then it becomes necessary to work very hard and improve these conditions, which definitely must be contributing to the accidents we have. I am happy the team, in their recommendations, they intended to roll out this to all regions, and that definitely would bring in other interesting results. But I would also probably think that with these low statistics, with these low levels of professional training and the possession of permit, it might be important to keep the study on the Boda Bodas, but also look at Boda Bodas holistically, regardless of whether they take drugs or not. because the remaining 9 in 10 who don't take drugs, they might also be contributing to accidents. So we also would want to know what is happening in that area. As I said, this is an interesting study which touches on critical aspects of our lives. So it might be helpful to look at these Boda Bodas holistically in other regions, but also focus on those who do not necessarily take the drugs. So probably when there is RIF 4, they could actually again come into the limelight and explore this area further. And I think it's a great area which should provide results that improve on our lives. Thank you very much.
Thank you very much, Dr. Zabona. Dr. Zabona is raising very important issues. First, he is inquiring the name of the test kit, and it is the oral saliva test kits. Maybe my colleague will add to this. Then he commended the team for the results, but intrigued by the 3% of the Boda Boda, only 3% are trained. They got professional training before starting riding Boda Boda. And only 11% of the Boda Boda have riding permit. So his comment is that this is a worrying situation, which actually should feed into a policy. And then he is also suggesting that there is need to study these Boda Boda guys holistically to look at other causes of accidents apart from the illicit drugs. And this could also maybe linked to the training and the permit issue. Thank you very much, Zabona. Yes, Dr. Kisache.
Hello.
Yes.
Good morning. I kept going off because of poor signal, so I missed a few slides. But I had 3 questions. Then I think 2 of them have been answered. One of them was on psychosocial help. Then you said you kept referring some of them for psychosocial help. Then the other was about the triggers, which was asked by Dr. Wakadala. My observation is, and this is the question I can throw to Olive, do you think you underestimated drug use among Boda Boda cyclists in Kampala? I'm asking this question because he said in the limitations, and it surprised me why you didn't say you expect some underreporting, because you said the test kit you were using, it couldn't really help you test for local substances, implying that the 1 out of 10 you're reporting, or 1 in 10, it seems to be at a lower end. Just imagine if the test kit would help you test or look for local substances. Don't you think the odds would go up, would be revised? And if so, I think you need to really highlight this again in the limitations. I thank you very much, but also congratulate you upon reaching this milestone. Thank you very much.
Thank you very much, Dr. Kisache, for the question. Do you think you underestimated drug use among Boda Boda in Kampala, given that the test kit could not test the local drugs, some of the local drugs? I think, I don't think so, because this statistics is comparable with other studies that we underestimated. But Pat can throw more light on this.
Thank you, Peter, Dr. Chisache, for your question. The question about us finding a low result when we conducted the tests was partly attributed to one. This study was conducted during the COVID-19 when the pandemic was, we had just come out of a lockdown and we had the curfew. We know that border cyclists use drugs that enable them to work longer hours. So if they are working till 6 p.m., that means the person has a small window to work and may not need to use a stimulant to enhance performance. Okay, so the fact that they were not working longer, working throughout the night, because they would always say in the past we would work even as late as 3 a.m., but it wasn't the case. And Dr. Kwagala can also. Additionally,
additionally, Peter, the qualitative sources told us that most of the people who take drugs, the cyclists that take drugs, work at night. So because our data collection and testing was during the day, we missed out on those that would work at night. If we were able to test at night, we are more likely to find a higher prevalence. Thank you.
Thank you very much for the response. We have Dr. Lukwata online.
Yes, thank you very much.
Yes.
The researchers and the conveners of this webinar, I want to congratulate you upon the successful completion of this research. We nearly failed to start it off, but I mean, I'm just so grateful that you managed to pull it off. And yes, the results are very informative. However, I would like to ask just a few questions. I'm the one who asked about the methamphetamines. I just needed to know whether you asked them what they actually took, so that then would know the source of the amphetamine, because I'm very sure they do not take something called amphetamines or whatever. There's something that they take which has that compound in it. So we would really wish to know which compound actually that they are taking that has the methamphetamines, and this will guide in the sensitization as you are suggesting in the recommendations. The other question that I'm asking is whether there was multiple drug use. I'm sorry I came on a bit late. You could have mentioned this, but I didn't. In case you did, kindly return to me. But yes, I just wanted to know whether there were higher chances of multiple drug use, like someone uses more than one, and if so, which combinations were very common amongst those that used that drug. Then the other thing that I just asking, I don't know whether this was asked also, was whether you asked as to how long the person had taken that drug. For instance, we know that some drugs begin to have an effect maybe after some hours. So like we would wish to know, what I want to bring out is that, the chances of the accidents, and in case, like if someone is already addicted, or even if we missed them out, we could have messages like, if you've taken your drug or whatever, and you're not supposed to drive, we could give them time, like maybe don't do it 4 hours after you've taken, or 2 hours. I would like to know this kind of information, whether it came out. I wanted to know whether I asked them how long ago one had taken the drug. Was it the day before? Was it in the night? Was it just any time? That is something I wanted to know. Then the other thing that I wanted to have a comment on was the recommendations. In the recommendations, there's where you wrote about the driving licenses. You talked about the driving licenses somehow, but I thought that in order to align it easily with the research, I would maybe ask that we should tag issuance of a driving license or renewal of a driving license to a test, a mandatory illicit drug test. I mean, that would be a recommendation you'd give out, because the chances that they're going to give a license to someone who is already addicted and may require first to be treated before they're actually allowed to go on the road. And then the other thing still around the recommendations, I imagine that it should have come out. It is related with the wards. And I'm suggesting that you could request that all those that are coming in with road traffic accidents should be checked for drug use, perhaps using this kit, for instance. Like this could be placed in the different accident and emergency units across the country, and they could help us to find out those that had road accidents and the amounts of perhaps drugs that they could have in their blood. Otherwise, thank you very much. Those are my comments. So thank you very much for this.
Thank you very much, Dr. Lukwata. She has raised very interesting questions and the suggestion for recommendations. The first question is, did we ask them what they actually took? Because what they took is what contains the compound, the methamphetamine. In the tests, we did not ask them, but these are the results of the test. The kits showed that they took methamphetamine. That's what the kit showed. So we did not really ask them what exactly they take. I think this is something that needs to be taken forward, and in subsequent study, it can be addressed. The other question is, was there high chances of using more than one drug, mixing the drug? I think we had a finding for this, Olivia. One person using more than one drug. Do you have the statistics? Yes, there were cases where cyclists took more than one drug, but we can actually get back to the data and pull this out because it is very important. Then the next question was, how long did they take drug? We did not have a question, this question. We did not ask, but I think it is a very important question. If a subsequent, another study is to be done, this question is very, very important. The recommendation, two recommendations doctor is suggesting is very powerful, I think. We could, there's need for discussion, tagging the issuance of permit with testing for drugs. If you are tested drug, you don't get the permit. I think could be very interesting thing. And then the other recommendation, also having this kit in wards, emergency wards where these people are taken when they get accident, so that they can be tested. I think it is interesting. We can have another question. Yes, please. Yes, I'm going to give Dr. Wamala a chance. Okay. Yes, Dr. Wamala, can you say something? Dr. Wamala is the director Harm Reduction Network, and he has been partner in this project, so he has a lot of experience in these drug issues and can help highlight some of the issues raised.
Good morning, listeners. I would like to respond. My name is Wamala Twaib. I work with Uganda Harm Reduction Network, a network of people who use and inject drugs. So there are two questions. One was regarding what happened to those identified in the line of research. So this research was well designed that we had a referral kind of system, though it was done during COVID time. But those patients that were identified during the study were referred to Uganda Harm Reduction for further management, where we are working with the Ministry of Health under Butabika. We have a methadone treatment clinic at Butabika. So when these clients were referred to us, we could subject them to further kind of tests like HIV, hepatitis C, and other tests. So then we take them through preparing them for further management. Then we take them to Butabika. I would like to inform you that during the lockdown, when these exercises were going on, we had a number of clients. The number increased because I think these Boda Bodas also informed their brothers and sisters that they are help somewhere. So we had a good number of drug users coming for treatment, and during that time we recorded a good number on methadone. So I would like to inform that those people who use drugs, we have a solution, and now this treatment is free for anyone, so long as you identify yourself and come to Uganda Harm Reduction Center. We shall be able to work with you through this process and you get better. So if you have, like among the listeners, if you have a student or a brother or a sister who need this kind of help, we're able to help. This methadone helps to calm down for people who are using very hard drugs, and even those ones who are using other drugs, other substances, they are able to be helped. I will not talk about crystal meth. I had Dr. Rukwata mentioned about it, but it's a stimulant that originated from India. It is on the street, on the market. So this is how these peddlers get these drugs, and they end up selling them to people who need such a kind of treatment. So this is an exciting study that is informing, because the biggest problem that we have been having was most of drug users use drugs, but at what level do they use, and what level of addiction do these people need help? So the addiction levels refers. So we only support those who come out. You can't force someone to come for treatment, but when a need arises, this person will find on its way to where there are services. But we encourage everyone to come for services. They are free. It is a government given under through Ministry of Health, and it is on the Butabika. So when you are referred to us, we shall be able to link you to where the services is. Thank you.
Thank you very much, Mr. Wamala, for that clarification. If I emphasize, if you have or you know any person who is using drug and needs help, you can refer that person to Uganda Harm Reduction Network, and they will be able to help that person. We have a number of questions which we should respond to. There's a question here. To inform possible intervention strategies, did the researchers ask how the drug consumers were introduced to these drugs? Did the researchers ask how the drug consumers were introduced to these drugs? Was it by friend, sibling, fellow business colleagues, self-initiative? Thank you. Yes, I think we responded to this question, and even in the presentation. Yes. Rogers, I don't see his hand. Rogers had a question.
Hello.
Rogers.
Hello?
Yes, hello, Rogers.
Hello?
Yes, Rogers.
Okay, Rogers Castle here.
Yes,
Though I'm
Rogers.
Mr. Mutawe's phone. I work with Uganda Youth Development Link, and
Yes.
I'm the executive director. Patricia approached us with the team, and we did some bit of information sharing. And I think the first thing briefly is to congratulate the team, because this population has been all along ignored. There have been confession of use of drugs, but we didn't know the magnitude. My only one is the smaller population which was covered, but I hope in the future we can cover a big population. Patricia, the question I want to raise to you and Betty is one, the findings are very interesting, but from a policy angle, you could go ahead and discuss more the implication of 1 every 10 using drugs, and discuss the behavior, the characteristics, the networking, whether we are likely to see an increase of Boda using drugs, and what will be the implication. Is the behavior going to spread? You could bring in some few theories here, which have argued that probably because of the spending the time, the networking and all that, that can be very dangerous. And this will help us, because if we are to advocate for treatment or primary interventions, prevention, then we need to understand those nitty-gritty, like one of the professors who said the confounding factors, but we could go ahead and discuss the behavioral dynamics and how this contributes to the problem. But the study is very interesting, particularly for this population, because now you have got a basis, a foundation to start. So I want to congratulate you, and I hope I'll be able to see the report, because whatever I'm discussing is based on what I've heard on Zoom. So share with me and we'll get back to you. Otherwise, thank you so much.
Thank you very much, Rogers. And this contribution is very important. We need to discuss the implication of the number we have found, and they have relevant theory to support it. I think this will be shared and will be shown in the report. We can, there are some few questions, more questions in the chat. Yes, there is a question. Don't you think this Boda Boda use the drugs because of lockdown induced stress? Dr. Kwagala, can you answer this? Don't you think this Boda Boda use these drugs because of lockdown induced stress? You can come and answer from here.
In answer to that question, I think it's possible, but we were also informed by key informants that people who use drugs are already, most times they started before actually the lockdown, okay? But it's likely that the lockdown could have also triggered that. Remember what Olivia presented. The first reason for drug use was in order to work hard. The second one was related to stress. And somebody also mentioned something about loans and so on. So stress is a major factor. It was the second most frequently mentioned reason. Maybe another issue I wanted to address that Charles raised was the issue of the linkage between age, is it age and
religiosity?
And religiosity. Before we fitted our model, we tested for multicollinearity, and there was no link between age and religion. Yeah, thank you.
Thank you very much. I think we can still, we have the data, we can still go back and look at the issue which Charles is suggesting, and then we see how it works out. There's another question: can this test kit help with prescription drug testing as well? Like drugs like morphine.
The kit has to be tailored.
Yes. Yes, but it can test some drugs like morphine. I think we remember a case of one person who tested and he told us that he was under certain drug for treatment, and he's tested positive for drug. Yeah. Another question? Question. To inform possible intervention strategy, did the researchers ask how the drug consumers were induced? I think this was answered. There's a comment: the amended Traffic and Road Safety Act now provides for prohibition of driving under the influence of alcohol and drugs, including some prescription drugs that affect the ability to drive. That is good. Thank you, Harriet. Yes, we asked about the sources. This is a response. There's a comment: tagging license to drug test might be tricky because some tablets given in hospital do have some drug components. I think it is something which needs to be really discussed, and the scientific, it's the scientific ability tested before conclusion can be made. There is a contact for Uganda harm reduction. Meanwhile, colleagues who are online, kindly register in a chat your name and your organization where you work and your contacts. I think these are the only questions here. If we don't have any question, I would like to move to the next step to invite Dr. Zahara to give a closing remark. Dr. Zahara is representing RIF, is speaking on behalf of RIF, Research and Innovation, Makerere University. So, Dr. Zahara. Dr. Zahara, you are welcome, kindly. Yes, that's Dr. Zahara. She's to give a closing remark.
Okay.
You're welcome.
Thank you very much, moderator. Good afternoon, ladies and gentlemen. The Principal College of Business Studies, the Dean of the Head of Department of Population Studies, and partners from the Ministry of Works, Uganda Police Force, civil society organizations, the Uganda Harm Reduction Network, and other stakeholders, faculty of the College of Business Studies, faculty from other colleges of Makerere University, students, ladies and gentlemen, good afternoon once again. My name is Zahara Nampeo, and from the School of Law, Makerere University. This afternoon, I'm pleased to be representing the chairperson of the Grants Management Committee of the Research and Innovations Fund, Professor William Bazeo. The Research and Innovations Fund is the funding stream to Makerere University from the government of Uganda, which has supported this particular research. The REEF, as we normally refer to it, is in its third year of operation. We started work in 2020. And let me start by congratulating the research team on this particular project for winning the bid and getting support for this kind of work. When I read the topic for the research, I was like, okay, Boda Bodas seemed very interesting, something that one would not versions is a really pertinent area, and it fits very well within the focus of the Research and Innovations Fund, which aims to support high impact research and innovations that inform national development priorities. So the objective of the Research and Innovations Fund is to increase the local generation of translatable research and scalable innovations that address key gaps required to drive Uganda's growth agenda. I think in Uganda now, you cannot talk about development, you cannot talk about growth. In the economy in Uganda, when you want to do something quickly, we let the team for selecting this budget makes a lot of sense. And where we as the Research and Innovations Fund welcome new up-to-date knowledge on the area. So the Research and Innovations Fund is very competitive. In the first year of operation in 2020, we received 702 applications, and we were only able to support two. In the second year, was able to support just above 160 proposals, and now in the RIF 3, we have only been able to support 170. So I do congratulate the team for being able to succeed in bidding, but also for putting forward a very strong research element. I'd also like to note from the topic of the research that it fits well within the National Development Plan of Uganda. And of course, you know that the NDP3 aims to transition Uganda to a middle income status. But in order to do that, governments and the government of Uganda must invest in research and innovations that provide solutions to persistent development challenges. This is also related to the research agenda. We have different priority areas under the RIF for research. And one of our research areas is achieving sustainable health as a means to sustainable development. So when you're talking about, illicit drug use, and you're talking about Boda Bodas, meaning people moving the economy, but they have to be in a fairly stable and healthy manner, we're really addressing the issue of sustainable health and sustainable development. There's a growing concern around the world, of course, about drug use. We have seen it just recently in the Olympics. It's always an issue that comes about, and I'm happy that we are looking at it with regard to road safety. Of course, the nexus between healthy minds and accidents and motor safety, accidents as a result of drug induced impairment. And whereas this is the end to the research findings, and it is worrying that 10% at least from the research, 10% of our motorists on our roads are actually under the influence of drugs. So I'm happy that this project helps to build knowledge about the national its impact on road safety. And this is not only important for enhancing health, generally having a healthy population to move the country's development agenda, but this is also an opportunity to guide policy and legislation on effective measures to prevent drug riding. And in this regard, therefore, board the relevant stakeholders. I know that you have worked with the Uganda Police Force, the National Drug, the Uganda Harm Reduction Network, and also the Ministry of Work. So all the relevant stakeholders have been on board, and these are important when we're talking about issues of legislation, policy, and enforcement of road safety. And the value that I see that is coming out of this research is up-to-date information that guides key stakeholders with new knowledge to support informed decisions. That I know that you have a policy brief that you're going to share. I hope that though that you can explore the options about how to integrate drug riding policies on the one hand with drug policy frameworks. We usually have two different silos where about the traffic regulations, drug use, the Ministry of Health that is geared towards the public health, oriented towards the public health. And in that way, usually we work in silos. But I'm happy that this project paves the way to bringing together the traffic related drug issue, drug aspects on the other hand. So I hope that there will be concrete legislation and policy frameworks that will guide enforcement of laws in this area. Otherwise, with those few remarks, I'd like to appreciate you once again for bringing to light a topic which may be taken for granted, but it is very important for moving the economy, moving the development agenda of this country, but also building the visit search-led university. Thank you very much for the contribution. Let me end by thanking also the government of Uganda for supporting the research agenda of the university and supporting and continuing to support and being to support the research environment in the research team. And good afternoon.
Thank you very much, Dr. Zahara, for the wonderful remark. We really appreciate what you are doing at RIF, and we look forward for more grants to support this project. Now we are moving towards the end of this session, and our next speaker who is going to give us a closing remark is the Dean, School of Statistics. That is Dr. James Okadala. Where is the policy?
Okay, thank you so much. Mr. Moderator, I cannot show my face. I don't know why. but it's okay. Thank you so much, presenters. Thank you so much, participants. My duty is very simple. Is first of all, move a vote of thanks to our dear researchers for doing a wonderful job of putting these findings on paper or in black and white, but also of really showing case to the public that really these issues are with us and part of us. So we have really done us proud and really taken time to interact and interrogate the data and the people's perceptions to come up with these findings. We really thank you for the good job done. The findings are spot on, like some of us who have listened in through and who have had a chance to participate. These findings are really very pertinent. And we are very optimistic that government or government MDAs will take up these findings to another level to guide their day-to-day service delivery, but also influence change in the policy arena of this country. Researchers, you have also heard that really more research is needed. This was like a pilot, but nationwide, really such studies are necessary because of the social demographic dynamics of this country. We are also looking forward to having a more holistic study nationwide to also capture lessons and experiences from border borders, from other parts of the country, such that we can have that holistic picture. We thank really the government MDAs for accepting to partner with us, because in most cases, you can approach an MDA and for some reason they say they are busy, but we really thank Uganda Police and other agencies for accepting to participate in this study. And I think this is something that is triggering us to establish what we call a policy lab or a think tank of some kind to be able to deal with government MDAs, to be part of them in influencing, first of all, generating evidence, but also influencing policy change, I think, moving forward. Finally, I have to really thank Arif for that good gesture of facilitating our researchers with a research grant to really be able to come up with such interesting findings. And of course, as the moderator has mentioned, more support is needed in this very direction of conducting further research in this direction. I thank generally Makerere University Management for supporting us with the necessary documentation and the conducive working environment for us to be able to reach this far. And we also thank other colleagues in the Department of Population Studies, but also generally School of Statistics and Planning for really supporting this very course. Finally, I really want to thank everyone for coming in to participate and listening in this study, for all your good contributions to inform the study further. May the good Lord bless you and be with you. I must apologize that I wasn't there physically in the room because I was also here trying to do certain things that are relevant for the school. Otherwise, I thank you so much and may God bless you and have a wonderful day and afternoon. Thank you so much. Over to you, Mr. Moderator. We are not hearing you, Mr. Moderator.
Yes, thank you very much, Dean, for the closing remark. And we have come to the end of this workshop. I've shared the policy brief in the chat with for members who are online. So you can access the policy brief. And if you have any comment, kindly please get back to us. We need feedback from you, and we thank you very much for the feedback we have got and for participating in this meeting. Thank you very much. This meeting is closed. You can leave at leisure. Yes.
Yes, I don't know how we can mobilize.
Yes, thank you very much. Thank you. Thank you very much. Amidst some sort of testing and strengthening collaboration across the wider something like that.
Yes, sir.
From this, we are integrating submitting this secretary.
After our full report, we are talking about and also